It was sad to hear Premier Smith say last week that her government stands by the principles of the Canada Health Act. No doubt she said it for political reasons. Heaven knows she took enough heat over private health care from the NDP on the election trail.
I signed a protocol with the federal government for 10 years committing to the principles of the Canada Health Act. That means that you cannot charge to access insured services. If that's what they are doing, they will be shut down, they will be fined, or we will withhold payments to them. So it won't be allowed to happen.
But in supporting a law that outlaws private billing for insured medical services, she has wed herself to something conceived in envy and sustained in absurdity. For in our dominion of equals, some drive big cars, some drive little cars, and some take the bus. As long as everybody gets where they want to go, we don't pass laws to interfere with how they get there. Same with food. Some have meat and some have none that want it, but there is no Canada Food Act. Health? God forbid anybody have something somebody else can't afford. That's the envy bit, and it's not a pretty sight. But here's the absurdity of it all. You can spend as much of your own money as you want to make yourself sick. Beer, cigarettes, extreme sports. But under the Canada Health Act, you may not spend a dime to make yourself better. To be sure, not all treatments are insured. But that itself is a further nonsense. You can buy a beautiful smile at a high-end dentist. You can also buy plastic surgery. Some say, I need it. So you can fix your face and satisfy your vanity. But heaven help you if you try to fix something that really matters, like the nauseating pain in your hip that you must endure for months, or the one in your knee, or in your wife's hip, or your wife's knee. These things you can't fix with your own money. Why do we think differently with health? Let's leave that as a rhetorical question. Folks, this is crazy, but that's how it is in Canada, and it's also how it is in North Korea and Cuba, by the way. Publicly funded healthcare is great, don't get me wrong. Most people are going to need it and use it. But for those Albertans who can and wish to, there are 3 good reasons to let them buy healthcare in Alberta. First, when somebody who can afford it goes to a private clinic, everybody else in the queue moves up 1. This leads to shorter wait times. Second, no offense to the good folks across the border, but if somebody is bound and determined to drop $50,000 on surgery, why not keep their business here, build more private clinics, and have them compete for Alberta's medical business? Third, we're already doing private health care for workers' compensation, the RCMP, and the armed services, all of whom have privileged access to the medical system and whose employers are billed separately. No problem with that, by the way, but we're also doing it for people out of province. If you're from BC or anywhere else in Canada, you're welcome to buy medical services here in Alberta. And as an Albertan, you can book private surgery anywhere else in Canada, just not in your own home province of Alberta. It's the same with all the provinces. If you live in BC, we can fix you up here in Alberta and send the bill. All quite legal and all quite unacceptable. You would never design things this way. Alberta will never have superb healthcare as long as it limits private enterprise in health. What we have is adequate, but often only available after waits that put us into a third world league of comparison. There's no doubt this is a tough one for the UCP, but they are at the start of a 4-year term. If they're keen on making the system work, as they say they are, there won't be a better time to start than right now.